My name is Megan Barton, and I'm 36 years old, and I live in Tonasket, Washington, and I'm the executive assistant of Mid-Valley Hospital in Omak. On Monday the 20th was really when I recognized I had the ability to check off 10 boxes of the COVID symptoms. I didn't never really establish a full fever, but I was having sweats and chills that were uncontrollable, and it didn't happen just randomly. It was all the time. It was like having a really bad flu. The cough continued to be a dry cough. It never became really productive ever. I felt like I had an elephant on my chest. I couldn't get air in, and I could barely get air out. Just to get up from my bed and walk to the restroom was excruciating because I couldn't breathe just to make those few steps over. I didn't realize it, but I had no appetite, none whatsoever. I didn't even know I had lost my sense of taste or my sense of smell. And it wasn't until a day or two later, and my husband had come down the stairs to bring me food, that I realized I couldn't taste anything and I couldn't smell anything. I don't know if you remember what growing pains feel like, but they're not comfortable. And it felt like I had growing pains all over again at 36 years old.
One of the things that you mentioned in your Facebook story that I think might be most alarming to some people is that you experienced a seizure. Is that right?
Yes. And I've never had seizures before in my life. And that was Friday of the week that I had become very markedly ill. And I was home alone. My husband had to go, I can't remember what he did, but he had to go somewhere. But he was on his way home, and I had a piece of pizza that was left for me in my little refrigerator. And so I was heating it up and eating it, and I started into a coughing fit. And then that seizure happened. And, I really wanted to tell myself, this isn't really happening. This isn't what it is. But my entire upper body started to spasm really bad. My hands were clenched, arms were clenched. No air was coming in or out. And I really felt like I was in danger.
I can tell you that I was very concerned about Megan because I could hear the progression of her symptoms. And as we talk, that's one of the important aspects of our job at public health and why we like to check in on people. It's amazing to me how we can have two people the same age and have totally different symptoms. Some people, like Megan and I were talking one day, I know someone her age who had a little tickle in their throat. That was it. They felt fine, no fatigue, no cough, no fever, anything. And that's the unknown about this virus, is how it's going to affect you, the individual.
I really want to encourage others who have gotten COVID, whether they are asymptomatic and they got a test and found out that they have it, but I want everybody to feel empowered to share their stories. I think more people need to hear them.